Hi, I'm Dr. David Leonard. I'm one of 6 ENT specialists here at Eastern Virginia ENT, and I want to put this video together because we see an awful lot of folks that come to us for sinus infections or sinusitis. Sinusitis means different things to different people. Some people, they come in and their main concern is pressure in the face or the head, headaches. Other people, it's a blocked up nose and trouble breathing. Other people, it's recurrent sinus infections with drainage, green or yellow, several antibiotics over the year. Other people, it may be sneezing, an itchy nose and itchy eyes. So we do a lot of history taking up front to kind of see if what the problem may be. We also do physical exam, where we use a small flexible scope many times to look inside the nose to see what's going on. And I want to show some examples here as well. A short video of just what that scope is like. It's very well tolerated. People do great with that. And also a few examples for CAT scans, because if you have some that were done previously, please bring them in. A lot of times you can have the radiology folks put them on a disc and we look at them right here in our office on our computer. Or if you have the actual film, bring the film in too, and we can look at that and go over that as well.
Here's an example of us doing flexible nasophayngoscopy. We use this flexible scope to look inside the nose. It may look a little scary, but we don't use the whole thing. Just enough to see inside the nose, to show us those turbinates in the nose, make sure there's no polyps, sinus infection, drip, drain, deviated septum, or other abnormal structures inside the nose.
So after we've had a chance to do a detailed history and a detailed physical exam, and hopefully if you've had films that you brought in, we would have looked at those as well. Now we try to put things together to see, is this a plumbing issue? Is there something in the nose or sinus that may be blocking things or may need to be straightened? Or is it a problem with the lining of the nose and sinuses, such as allergy, chronic infections, maybe an immune deficiency? And then we put together a treatment plan. And treatments for sinus issues really kind of fall into 4 broad categories. One is medications. If you've been on medications already, we may look and try to fine-tune those or add some things that may not have been tried before. Second is, as surgeons, we do ear, nose, and throat surgery and sinus surgery. Usually that involves very small scopes through the nose so that there's no scars. We also use balloon sinuplasty, little balloons to help open up the sinuses to help them drain and breathe normally again. The third treatment option is sometimes we find that the allergies are really the main component that's blocking the sinuses and giving you symptoms. And so we'll, again, work with the allergy medications, and we also do allergy testing and allergy shots for those people that are recalcitrant to that. And then sometimes we find that the sinuses are normal, and allergy testing shows that there's no allergies as well, and the symptoms that we initially thought were sinus infections might indeed be something different, such as a neurologic headache, perhaps TMJ, perhaps a dental issue as well that can masquerade as sinus infections. In those cases, you'd find that we would refer you to the appropriate subspecialist or specialist to further treat those issues.
Here we have an example of a CT scan that someone had brought in for us to look at. Air is black, bone is white, and soft tissue is gray in between. The yellow arrows here show the deviated septum. That's the wall that divides the left side from the right side of the nose, and here is very deviated to one side, blocking his nose. Soft tissue itself is gray, so for example the brain, the eye, the fat, and muscles are all gray. In this example, the yellow arrows show the confines of the orbit where the eye and the eye muscles and the nerve to the eye live. Here are the sinuses. In this case we can see 2 of them. The yellow arrows show the maxillary sinus, the cheek sinuses, which live below the eye, and the red arrows show the ethmoid sinuses, which are between the eyes themselves. And this is how they should look: all black, which shows nothing but air in them. There's no thickening or fluid inside. Here we see in the yellow arrows the inferior turbinates, and the red arrows are the middle turbinates. The turbinates are hot dog shaped structures that moisten the air and warm them up as you breathe. Basically, I call them the radiators of the nose. In this example, they're very large. The patient had a lot of trouble breathing. And this is the same patient after being appropriately treated with allergy medications. As you can see, they are much smaller, and the patient responded much better and could breathe normally. Here's an example of a before and after CT scan of the frontal sinus. You can see the yellow arrow shows some thickness and fluid inside the right frontal sinus, and then the green arrow shows this after appropriate medicine treatment, antibiotics, Mucinex, and some steroids. Again, the patient was feeling much better. Here's an example of what we see using the endoscope inside the nose. The yellow arrow shows the middle turbinate, where the maxillary sinus wants to drain and open up is next to that in that cleft. There's a big polyp, which is seen with the red arrow, and that polyp is obstructing and blocking that sinus. Here we see a different patient than the one previously, but you can see that the yellow arrow shows the normal right maxillary sinus, the red arrow shows the blocked left maxillary sinus, and the green arrow shows the very small area where the sinus wants to breathe through or ventilate or drain, which can be blocked and lead to sinus infections and blockage.
Hopefully you found this video instructive, as well as the examples. If you'd like to see us, please feel free to call our offices. We have 3 offices here in the Virginia Beach area. The main office is in Chesapeake. We have a second office in Virginia Beach, and our third office is in Western Branch. And we'll play the phone numbers and the locations for you here shortly. And we do have a website you can look at as well. Thank you very much for your time. Bye-bye.